When it comes to creating an arterial venous fistula, we know that success often boils down to just a few critical moments of geometric precision. Today, we're going to laser focus on one of those details, the one that can really mean the difference between long-term patency and early failure.
So let's start with a really practical question, one that every access surgeon has to think about. When a brand new fistula fails because of a technical problem, where is that flaw most often located? You know, the answer might surprise you. It's often not in the anastomosis itself, but at a very specific and sometimes overlooked transition point.
All right, Section 1, the critical juncture. Let's really get in there and identify this high-risk zone and figure out what exactly makes it so vulnerable.
So what are we talking about here? This location is called the venous swing point. It's that exact spot where the mobilized vein makes its final turn, its final approach, to meet the artery for the anastomosis. Seriously, the geometry right here is everything.
And this is so important to understand. We have to reframe our thinking here. This is not just some static point on an anatomical map. No, it's a dynamic zone where the geometry we create as surgeons directly shapes the future hemodynamic environment. The curve, the tension, the way the vein lies at this one spot, that's going to dictate the flow dynamics for the entire life of that fistula.
So that brings us to Section 2, Anatomy of a Failure. This is where we're going to see how acquired stenosis is basically born, right at this critical juncture.
And here it is, the central problem. The literature confirms what we've seen in practice. The venous swing point is an incredibly high-risk area for acquired stenosis. And this isn't just bad luck, it's a predictable consequence. It's a hemodynamic result of imperfect surgical mechanics.
This slide just lays it out perfectly, the two completely different outcomes. On the left, you've got a smooth transition, this beautiful, gentle, sweeping curve. That promotes smooth, laminar flow and, you guessed it, long-term patency. But then on the right, you have a kinked or a sharply angled transition, and that, right there, is a direct setup for turbulent flow, for endothelial injury, for neointimal hyperplasia, and ultimately, for stenotic failure. The entire fate of the fistula is often decided by which of these two paths is created on the table.
Okay, so how do we avoid the bad outcome? Well, that brings us to Section 3, the principle of precision. And this is about more than just avoiding failure. It's about proactively engineering a successful outcome right from the very beginning.
Engineering that success really requires following what I'd call surgical mandates. First, you've got to meticulously mobilize that vein. Make sure you have adequate length, total freedom from any tethering. Second, and this is key, visualize the final, gentle lie of the vein before you even place a single stitch. Third, you have to actively create that smooth, sweeping arc. And finally, maybe the most crucial step of all, do a diligent final check to eliminate any and all potential for torsion or kinking.
Let's be absolutely clear on this. Achieving a smooth, non-kinked transition, well, that's not just a technical nicety. It's not a suggestion. It is an absolute prerequisite for a durable fistula. It is a non-negotiable part of this procedure.
All right, Section 4, the final check. Let's take a moment and just solidify the key takeaways from all this.
So let's just recap the flow of logic here because it's so important. We have to recognize the swing point as a known, predictable failure zone. In this zone, kinking isn't just a risk, it's a direct cause of stenosis. So that means prevention lies entirely within our surgical technique in creating that smooth, gentle transition. And when you think about it, that means our attention to this one single detail can really determine the entire long-term viability of the access we're creating.
If you remember just one thing from this entire explainer, please make it this. Precision at the swing point dictates success. It's truly that fundamental and it's that powerful.
And so we'll close with a question, really just for you to reflect on. As you visualize your next AV fistula creation, just ask yourself, in my practice, is this one critical detail, this venous swing point, is it consistently getting the meticulous, focused attention that it truly deserves? It's a question worth asking.